Hi, and welcome back, everyone, to another topic. For today, it is erectile dysfunction, focused on male disorders. So let's begin. So, the causes for erectile dysfunction are age related, mostly because when a man ages, they have low testosterone in their body. So, they are producing as much testosterone as they were when they were young. So, that leads to decreased libido because they don't have enough testosterone to get their libido going. Drug induced, some of the drugs that do cause erectile dysfunction are antihypertensives, and along with a lot of other ones. And these are really important to determine to know if a client is complaining of erectile dysfunction, to know to look at their drugs and see which ones might be causing the erectile dysfunction, to see if you can talk to the healthcare provider and say if there can be any other alternative drugs out there that he can use instead of the ones that might be causing the erectile dysfunction. Psychological issues such as stress, anxiety, and depression, all of those cause erectile dysfunction. So, talking to the client and trying to determine the root of the problem might help with the erectile dysfunction. Other medical conditions can also cause erectile dysfunction, such as diabetes, hypertension, and peripheral vascular disease. All of that can cause erectile dysfunction in males. The assessment, as discussed earlier, is just basically the sexual dysfunction and being unable to maintain an erection during intercourse. So, when the nurse is trying to ask questions specific to this, they must understand that a man might not be as open to talk to a female nurse. For one, they might not want to talk to them because it's something so sensitive to them, and it's so personal to them, and to be able to talk to somebody about it might be very hard for a man. So as a nurse, you have to understand that they might not be open at first, but if you let them know that you are not there to judge, and there is nothing for you to like either make fun of them or like bring them down or nothing like that. Like, you are there to help, and you just have to let them know that there is no way that someone can help if they don't know what the problem is. So it's really important for you to verbalize that to the client. Some interventions are vacuum constrictive devices. These devices are used on a client, and basically what they do is just it works as a vacuum. It basically just pulls blood into the penile area, and then it causes an erection. And then intraurethral devices, these are used in combination with other drugs as well to be able to maintain the erection. So not only do you have to get a device, you also need to be taking drugs along with this in order for it to be able to work. So penile implants are very risky. They have a high risk of infection, a high um, risk for surgery as well, risk for infection. So that's pretty much basically the one thing that you should look out for. But they are only used for clients who have severe erectile dysfunction, and that's something that the physician or uh, the surgeon, they have to determine if they really do have a severe erectile dysfunction in order to even be considered for a penile implant. And then a PDE5 inhibitor is also used. This is a drug. Basically, it relaxes the muscles, and it allows blood to flow more freely, and it will go into that area specifically to be able to have an erection for someone who is suffering from erectile dysfunction. Some considerations that you might have for this client is sexual counseling, just letting them know that they are not alone and there's people that can help just as long as they verbalize that they have an issue. And then for sexual counseling, it's best if they bring their partner with them, because this is something that's not only affecting him, but it's also affecting her, because it can also bring feelings to the woman and his wife. Like, she might feel like it's her fault or whatever. So it's very important to, once you determine the cause of whatever might be causing it, sexual counseling might help increase and better the relationship that they have going for them, and also make them comfortable enough, like I said earlier. And do not judge them. When you are a nurse, you are not there to judge anybody. You are there to help in any way that you can, in any possible way, for everybody that comes to you asking for help. So it's really important to take that into consideration as well. So that is it for this video on erectile dysfunction. I really hoped you did learn something from this video, and don't forget to subscribe